progress is impossible without change, and those who cannot change their minds cannot change anything. A quote by George Bernard Shaw, which resonates with Namibia as it gears up to transition from stage 3 to stage 4 at midnight tonight. Tonight we discuss the lessons learned in the justice, health and business sector, as well as explore mitigating efforts and collaborative methods in pursuit of a COVID-19-free Namibia. A very good evening and a warm welcome. My name is Denver Kisting and I'm joined by sign language interpreter Penofina Aces. On the panel tonight to unpack these matters, I'm joined by the Minister of Health and Social Services, Dr. Kalumbi Shangula. Good evening, Doc, and welcome.
Good evening.
I'm also joined by the Minister of Justice, Ms. Yvonne Dosap. Good evening, ma'am, and welcome.
Thank you very much, Denver, and good evening to the viewers.
For more female representation, I'm also joined by the Namibia Chamber of Commerce and Industry Chief Executive Officer, Ms. Charity Muya. Good evening, ma'am, and welcome.
Good evening, and thank you for having me once again.
We're also joined telephonically by Inspector Eleni Shapumba from the Irongo region. Good evening, Inspector. Good evening, Inspector.
Yes.
Good evening and welcome.
Thank you so much.
Before we get into tonight's conversation, I would like to give an opportunity to the Minister of Health and Social Services, Dr. Kalumbi Shangula, for the latest health update. Doctor.
Thank you very much. Good evening, fellow Namibians. I will give a summarized report on the COVID situation in Namibia this evening. We have 13 new confirmed COVID-19 cases. 8 of the cases are from Walvis Bay. 3 are from Hardap region. 1 from Oshana and 1 from Zambezi. 8 are contact of confirmed cases and 3 were identified during active case search and 1 traveled across the borders. It's noted that for the first time we have a case in Oshana. It has its origin in Walvis Bay. And also the 3 in Hardap region, they have their origin in Walvis Bay as they travel from Walvis Bay to attend a funeral. The rest of the picture looks as follows. We have now in Namibia a total of 196 confirmed cases with 24 recoveries and 172 active cases. We do not have a death in Namibia. You were informed during the meeting, during the morning briefing, that case 22, which has been in ICU, have been discharged from the hospital, which is a very good sign. The total sample tested is 8,913, active contacts 812, number of people quarantined 3,791, of which 2,927 have been discharged, and we are remaining with 864 in our quarantine facilities all over the country. I thank you.
Thank you very much, Dr. Kalumbi Shangula, the Minister of Health and Social Services. With the latest health update, Namibia now has 196 confirmed cases of COVID-19. 24 of those have recovered, 172 active cases, 13 new cases reported this evening. Inspector, I would like to move over to you in the Irongo region, particularly Walvis Bay. Please give us an update about what's happening there.
Yes, thank you so much. Maybe first and foremost, let me humble myself and acknowledge the presence of the honorable ministers. We, the police or the law enforcement officers comprising of the Namibian Defence Force, the Correctional Service and the Namibian Police Force with our other stakeholders, we are engaged with the day-to-day activities that includes manning of the 3 roadblocks in the region, one on C14 Road of Wolfsburg, another one on the road between Swakopmund and Hendisburg, and the other one on the road between Arandes and Usakos. And then we are also engaged with activities of guarding the quarantine facilities, ensuring or providing supports to our colleagues at the testing centers in Wabuspai, and also ensuring the presence of police officers on the ground or law enforcement officers on the ground to control the crime in general. This is based on the fact that we are currently under stage 3, where the movement of the people have reverted back to normal, and that means that even criminal activities, normal crime will now start to pick up or have already started picking up, especially the economic crimes in terms of housebreaking, robberies, as well as perhaps theft, general theft and others.
Inspector, despite that elaborate and comprehensive police presence, we have received reports that people are making use of alternative routes to travel in and out of the Irongo region. How do you prevent people from moving from areas that they're not supposed to, especially if we have regard to the local authorities of Arandes, Swakopmund, as well as Walvis Bay?
Yes, we, the police, have duty to issue permits on critical reasons, or when people present to us very important reasons, valid reasons that will not prevent a normal human being to issue that particular permit. But we have decided to take unpopular decisions to say that we can only issue permits really if the situation warrants such. However, we should also remember that there are other stakeholders that are also empowered to issue travel permits in terms of maybe essential businesses and maybe on health and other related issues. So what we do is we ensure that our roadblocks are properly manned and the members are properly briefed. And then those that do not have permits will never be allowed to travel. In as much as we wish to trust our fellow Namibians, there are just individuals that are also trying to take chances, coming to queue up at the police stations looking for permits even if they do not qualify, as well as others who are trying to sneak out of the restricted areas using unauthorized routes. But all those situations, we are taking control of it, and we make sure that we curtail as much as we can the movement of the people, or at the end of the day, we prevent the further spread of the disease or the virus to other parts of the country.
Very well, Inspector. 3 of the cases announced by Dr. Shangula earlier are in the Hardap region. And according to Dr. Shangula, these are human beings who traveled from Walvis Bay to the Hardap region for a funeral. What is your comment on that?
It's really a concern to us in as much as we know there are some of the traditional rituals that are so respected in our communities. Maybe we have even some of the station commander has gone to an extent to say that before you travel, maybe go and get tested and all that. But if the law authorizes us to issue a permit for a person to travel when you are to attend a funeral of a first degree or maybe second degree family members, then we have no powers to refuse to issue that permit. There was a time when even the regional commander had to go an extent of taking a decision of the commander to say we will not issue permits, but it was unfortunately also not within the ambit of the law. But then we are saying that all we can do is to control, to ensure that those that are traveling are really qualifying to do so. But we are appealing perhaps to our colleagues from the Ministry of Health to assist in as far as first testing. But the people themselves should also, this issue should speak to their consciousness. We do not want to police adult people as if you are dealing with the kids. There is a time when we, as citizens, should also remember that we should do what we're supposed to do. We should act responsibly. So everything is left in their hands. Everything is left in our hands to make sure that we control. But then they should also come in and assist us to ensure that we do not distribute the virus further.
Speaking of funerals especially, and I don't want to belabor the point, and permits required to travel for that particular purpose, How does one prove that you're a relative of someone who's passed away? It's easy to prove that you're someone's spouse or that you're someone's child or parent. But how do you prove that someone's, for example, your aunt, and I need to travel for this purpose to this person's funeral?
One thing, number one requirement is that you should produce a death certificate. And then when we produce a death certificate, we have to do our own internal investigations before we give you a permit. Now, if the investigations prove that, yes, indeed, the person is related to the person, so in a close sort of relationship, and we are dealing with human beings, us being human beings, before we become police officers, you have to consider to say that if the mother has passed away, the sister has passed away, the father has passed away, these are close relatives, and there are certain rituals that people perform, and they are so respected in society. However, we say that they present the death certificates and we investigate before we issue a permit.
Inspector, there are also reports that people from Walvis Bay especially, despite it being a restricted area, are still moving all over the place. Is that so, and what are you doing about it?
Like I said, there are individuals that are moving on essential sort of maybe business. You speak about people that are traveling on medical ground. If a person comes to us with a letter from the doctor, I, as a police officer, may not dispute that doctor, that letter from somebody with authority. So we are saying that there are individuals that are trying whatever they can do to ensure that they move. And unfortunately, at that point, when they qualify to move, we may not stop them from moving. If a person is given a letter from the doctor, like I said, that person has to go. Otherwise, if you stop, anything will happen. Will not be able to account for our decisions. There are some, obviously, that were arrested in places like Windhoek that traveled in 7-seaters using unauthorized roads. And at the end of the day, these particular individuals were found without permits. And that is a challenge that we have, as we are saying, that there are people that are not really considerate of the seriousness of their actions sometimes.
Inspector, we're mindful that you have your hands full, so we need to let you go. What are your brief concluding remarks, please?
Perhaps I can only say we have a responsibility before us. We are dealing with the virus that is among us. We should reason humanly to say, if we are living within the situations, let us not distribute it further. We should understand that we are in a situation, and we should direct our actions and also our thoughts towards helping the country and helping our towns. If the virus is within us, it's only us that are going to assist ourselves to make sure that the virus disappears from us. We still have individuals that are walking around in the streets aimlessly, in as much as they are given the right to do so. We say, please do it when it's essential for you to do so. You should protect yourself. If you cannot protect yourself, there is nobody who is going to protect you. Unfortunately, we have found challenges. Our officers, when they are dealing with the communities on the ground, they are arguing with the police officer sometimes, and we look at it and say, a police officer coming to you or a law enforcement officer coming to you to tell you to do what is right, but to have the audacity to argue with that particular individual. Sometimes we should think, go back home and say, but did I really have to argue with a person that is protecting me? Or should I protect myself? Could I have avoided this situation? So these are things that we want to educate our public to really take a responsibility and ensure that whatever we are doing it together.
Thank you very much, Inspector, and best of luck to you and your team.
Thank you so much for having us.
That was Inspector Eleni Shapumba from the Erongo region with a very important message, but also bringing us up to date and up to speed with the situation on the ground in the Erongo region. I'd like to get into tonight's conversation. Doctor, as far as the Erongo region is concerned and the surge in numbers that we have been seeing, especially last week, is there a reason for concern?
Yes, I must say that we have reason to be concerned. We had a reason to be concerned when we had one case. When we had the first two cases, we were already very much concerned. And as the numbers started to build up, we become more and more concerned. We had a situation when, after we recorded case number 16. We had a period of 45 days without registering a single case. And then cases start building up. We had a very good containment strategy that anybody who comes into the country will be quarantined and tested before being released. But then we had a situation when people who came from outside happened to sneak through the net, get into the community. When they were picked up later, it means there are already some individuals who had been exposed. There is one interesting phenomenon as far as Walvis Bay is concerned. Now, Walvis Bay and Commerce had been under lockdown for some time. Then Walvis Bay, Erongo went for another lockdown for 3 weeks. And immediately after the transition to stage 3, now we see these waves of cases coming out, which in actual fact point to the fact that this transmission happened during the lockdown. What does that mean? It means there has not been full compliance with the measures which were put in place under lockdown, under stage 1. And that resulted in the situation which we are observing today. What is also concerning now is the fact that whereas in the past cases which are occurring in other regions were those cases from our quarantine facilities. People who come into Namibia, we quarantine them, we test them, they test positive, but they have been in quarantine. But then it is very much concerning now that you get a case, for example, in other regions which are not emanating from the quarantine facility, which will mean that there has been certain movement of people. I always say that COVID-19, the virus, the corona, is not there flying around attacking people. No. It's people who go to look for it. It's people who go to disseminate it. If we could observe the measures which are put in place, sanitizing, social distancing, using masks. By the way, there are now new evidence, scientific evidence, that support the effectiveness of wearing masks. And this one we will continue to emphasize. The wearing of masks, they have been proved scientifically that they are effective in the prevention of the transmission of coronavirus. Therefore, we should put emphasis on these measures for personal protection.
Thank you very much, Dr. Ms. Dosap. Dr. Shangula has already expressed concern about non-compliance with the regulations from his perspective. Namibia is scheduled to transition from stage 3 to stage 4 at midnight, talking about the 13 regions. Erongo is still in stage 3. What has your perspective and observation been?
Thank you very much, Denver. My observation has been there's been substantial compliance to the extent that there is a huge effort by Namibians to comply with particularly the wearing of masks. But there has also been a huge problem with the correct wearing of mask, I found. So people have their mask with them. And I find that is, in a way, a preemption of if I'm found by law enforcement and I'm asked to put on my mask, I will have it. By analogy, I find that we have found ourselves in a situation where people put on the seatbelt when they are approaching a roadblock, and then they take it off as soon as they pass the roadblock. And I think that's a problem. I think Namibians have not, kind of from a philosophical viewpoint, internalized the importance of wearing of mask and keeping social distancing, and also sanitizing and the hygiene that goes around with the, to avoid the further spread of the coronavirus. So my own observation is we are generally very, very relaxed. I think there is a pocket of our society that takes us very, very seriously. I have seen on a number of occasions, I've been to funerals where people have maintained a register, they have made sure that there are only 50 people there. But I do find that people still have the challenge of maintaining social distance. And I think because of that challenge, people must be overly vigilant when it comes to the correct wearing of the mask. What I also now see is that people are also starting to theorize coronavirus. So it has become an issue of intellectualizing it, to say, does it exist or does it not? And so people start to argue against it.
Do you believe it exists?
I have seen people die from it. So the evidence that I see on the ground, I've seen people get sick. So, if that thing that is happening is called coronavirus. That's what I believe. And I think anything contrary to that, I don't know what evidence you have to say that it doesn't exist. The other concern that I have, and this is a overall observation that I've made, is that people also now avoid. There's also a fear of testing, because people are concerned about if they get tested and they are found to be positive, then they are concerned about the number of people that will have to be either exposed or will have to be subjected to the test. And so people now also, I find, are avoiding being exposed to a possible testing. And this you find in the kind of information also that people are now providing in the logbooks, because people don't want to be part of, to be traced, for instance. And that's problematic, because it means, whether or not, because this thing exists, if we are found to have gotten, because at some point you will start to show the signs, I'm sure, Dr. Shangula, so you cannot really completely avoid it, but I think prevention is really, really better than cure. So I think let's really, really take the measures that have been put in place very seriously, particularly as we are moving on to stage 4.
As far as the wearing of a mask is concerned, the proclamation which the President signed yesterday already for stage 4 indicates that the wearing of a shield is permitted, provided you also wear a mask. So why would I then wear a shield?
I think, I'm not sure, maybe Dr. Shangula has an answer for that, but I can completely see from a layperson's perspective. I have seen how people wear those shields. And what I've also seen is the possibility of droplets dropping out, down from those shields is real. So it maybe depends on how much coverage your shield does. There must have been a scientific or health explanation why the combination of the two, particularly if you have a shield that does not completely cover and is unlikely to prevent the transmission of the droplets, I think.
Doctor, I will give you an opportunity in a bit just to talk to us very briefly about that. Ms. Muya, how has COVID-19 affected the way we do business, especially in Namibia, and how have businesses had to adjust to make sure they try and make ends meet?
Thank you, Denver. I think it's very obvious that from the beginning, nobody really expected the extent of how this pandemic would actually, affect the communities and our way of doing business. And I can actually say that I think from the time of the lockdown already, the first lockdown period or whatever, there was already some bit of a shocker, but obviously some adjustments in terms of how businesses are supposed to now adjust to do their business operations. Especially since this pandemic really is about public health and obviously way business have to interact, people have to interact, and now the restrictions that are coming with all these regulations, it has completely changed the face of actually doing business, where people would actually want to go and make sure that they go and do their shopping or they go and meet their suppliers. Now that is limited. Consumer behavior has also changed because when people have to go there, obviously, right now, consumer spending has actually also changed. Clients, when they want to go there, they wouldn't want to go and be queuing and go through that process. And alluding to what the Justice Minister just said now, that, people are not really that confident now to actually give up their information and all those things, whatever. Obviously, for businesses, that now becomes a challenge. Businesses themselves have made sure that they have put in place, all those to comply with all the regulatory measures that are in there. But obviously, the challenge still lies with our smaller businesses. This is something that is, indefinite. We don't know how long it's going to last. Now, for their budgets to be affected, to ensure that they put all those precautionary measures in place, obviously, that's very straining on the smaller businesses. In terms of business operations, maybe the larger firms, of course, they would have already, transitioned to digitalization and all of that. And maybe the extent of the impact to them might be moderate, at least for the time being. But for the smaller business to start now investing in all this technology and adapting to all this technology, the way of doing business as well, particularly the different sectors, the accommodation establishments, the retailers, even the airlines now, obviously, they have to make serious adjustments, obviously affecting budgets that they did not actually, obviously, foresee. But I think we are grateful from the chamber side that, we have seen that we have made some spot visits to some of the business premises, and you are seeing that there's compliance to regulations. They put the measures in place, obviously. But of course, in the informal sector, that is a bit quite different because, the trend now, because of the consumer behavior, you find that now they want to also adjust to say, is there a way I'm supposed to now, instead of a client coming, how do I reach to the client? Because that's exactly how the trend is actually now going. So,
thank you very much. If you want to participate in tonight's conversation, if you have a question for one of the panelists, the number to dial is 061 291 339. That's 061 291 339. Please remember to switch off your television set or your radio to avoid any confusion and keep it brief. Dr. Shangula, perhaps very briefly on the shields and what purpose they serve, if any at all.
Yes. I will talk briefly about the shield, but I also wanted to elaborate more on one point which Minister Yvonne has touched. But let me start with the shield. Now, when you put on a mask, you cover your nose, you cover your mouth. Now, in terms of protection, you are leaving this part, which is also sensitive, open. Now, if you are in a conversation with somebody who does not have a mask, obviously, even if you have your mask, you are not protected. Now, what the shield does, it covers the upper part, protecting the eyes, and then for the shield to be effective, you must also put on the mask, so that whatever droplets comes out of the mouth, out of the nose, out of the mouth, is contained. Therefore, now if you're only having the shield, so the droplets from the nose, from the mouth, they will still find their way down. And that's why, even if you are having a shield, it is not really a protection to another person. And to you are become actually a source of infection to another people. But you have covered yourself, the upper part, but your droplets are still making way out into the environment, which can then affect another person. Now, on the point of compliance, which Minister Yvonne Dowsab has mentioned, you see, this virus have given us a big challenge. We are not used to wear masks, so it's something new to us. Okay, apart from those who are in the hospital environment, who are normally, work with masks, etc., but not the general public, they are never used to wearing masks. It's also not so much comfortable. So it's great effort, which we also appreciate that the public have embraced it. The other point is that Namibians, they are normally warm-hearted people. You shake hands, you hug. Now you are told you must be far away from somebody. It's another challenge.
Especially at a funeral, you can't even console someone.
Yes, it's another challenge to get used to it. So those are challenges which we are facing, but it's really appreciating the efforts, what people are making to try to learn how to live with mask on, and also how to keep a distance from somebody who's so close to you.
Thank you very much, Doctor.
Yeah, so that is really appreciated.
Thank you very much, Doctor.
And that brought us here, where we are now.
Thank you, Doctor. We've got our first caller this evening, Timo from Luderitz. Good evening. Good evening.
Good evening, Denver.
Yes, good evening.
I just have two questions.
Keep it brief, please.
The first question is to the Honorable Minister of Justice. Was the cases confirmed in Hardap? I just wanted to find out whether Hardap will also move to stage 4, which we are moving in tonight, midnight. And then the second question is to the Minister of Health. This testing, is it happening everywhere in the country, or do you have certain targets where you are doing the testing? Those are my two questions, Denver.
Thank you very much, Timo. Thank you very much.
Thank you.
Mr. Sip?
The way we've communicated with our society is, normally before we move to a stage, we would have made an announcement by the president, and there will be explanation about what's going to happen next. The decision that was announced last week has not changed. In other words, we are moving, 13 of our regions are moving to stage 4. Erongo region, which is governed under a different regime of regulations, is going to be in stage 3 until 6 July. And that, and the special arrangements for Wolfies Bay, Swakopmund and Arandis will also remain until the 6th of July. So, yes, Hardap is moving to stage 4.
Very well. Doctor, the question relating to testing, are we just testing particular areas or are we testing everywhere?
Yes, there is a difference. There is a point where you collect the specimen, and there is a place where you do the actual analysis of the specimen. So the collection of specimens is done throughout the country, whether it's Wolfies Bay, whether it's Karas, whether it's Katima, whether it's Hobabis, everywhere we collect specimens throughout the country. But the testing, the analysis of that specimen to give you either a positive or a negative result.
Or an inconclusive result.
Yeah, or an conclusive result is done in Windhoek.
Doctor, as we reflect on how ready we are for the situation in Erongo with the surge in infections, what lessons have we actually learned since the 14th of March when our 2 index cases were announced?
If I get your question very well, you are asking what did we learn in terms of testing or in terms of managing the pandemic?
In terms of managing the pandemic.
Okay. In terms of managing the pandemic, as I have already said in the past, you see, this is a new situation in the whole world. It's a new situation. Now, there is no way you can go and say in that particular event or to go to any literature, this is how it was done with COVID-19. It never existed. So how we manage the epidemic, we draw from knowledge of public health, epidemiology, how the diseases actually multiply in a population, especially when we have a situation where nobody has got immunity against COVID-19. Nobody has got that. So it is a whole susceptible population which can easily, in which the transmission can easily take place and the propagation of the transmission will occur. Now, what are we learning from that? We are documenting whatever we have done. And as we move with the pandemic, we change strategy, fitting that particular situation. And that is really what we are trying to do, to see which one will work best for us.
Thank you.
Yeah.
Mr. Osap, moving to stage 4, the 13 regions, it's also a manner of changing strategy. What has the justice sector learned thus far?
We've learned that we need to diversify the manner in which we conduct our, for example, our court business. We need to diversify how legal services are made available to the public. And here I'm talking about things like maintenance payments. You know, typically people walk to a cash hall, they have to stand in a queue and get the payment. And we need to think about, during a time like this, how can people still access their funds, you know, without having to wait for what systems can we put in place to ensure that those services become available to our public, whether it's maintenance and also things around, questions around sexual violence and domestic violence. Remember, during the lockdown and during the state of emergency, there was a reduction in the service delivery, but the system itself had not shut down. So the courts were open, the cash halls were open, for example, access to protection orders were open. But I think the thing that the justice and legal service sector needs to think about, and what particularly the independent legal profession needs to think about, is how they too can diversify their style of work. You know, their dependence on maybe just one stream of income may not work if a pandemic like this catches you. Or how they can become, you know, pro bono legal practitioners during a pandemic, for instance, and not just focus on how they can make money. So those are some of the lessons I think that we are learning, but also how as a legal profession, how as the justice sector we can do things in a way that we can hold hands, really, you know, as a collective in responding.
Proverbially.
Yes. That's the one thing. But I think, Denver, it's important for me to pause here and maybe talk a little bit about some of the key changes that we will see in going to stage 4. One of them is the fact that we're now going to increase the number from 50 to 250 in the 13 regions. It will remain as 50 in Erongo and as 10 in those 3 local authorities. This is important because this is really where your biggest challenge is. If you hear what the good doctor was telling us about the cases in Hardap region, it happens at funerals. We have seen that funerals and weddings are super spreaders of the coronavirus, precisely because, and understandably so really, that people are unable to continuously maintain social distancing. You may consistently wear a mask, but you may have a challenge about sitting 1 meter apart from somebody that you have not seen in a long while and that you need to be talking to. So there's really a lot of vigilance that is required when it comes to public gatherings. And then the other one is the question around the business activities opening up. Clubs will be opened up. Bars and shebeens, and I want to explain something here. When it comes to bars and shebeens, at the moment, the understanding is we are still limiting the sale of alcohol from 9 o'clock to 6 o'clock in the evening from Monday to Friday, and then Saturdays from 9 to 1 o'clock. And public holidays and Sundays, no alcohol is allowed.
Even for bars and shebeens?
Even for bars and shebeens, no alcohol to be sold. Now, for bars and shebeens, there is no provision at the moment to sell alcohol beyond 6 p.m. And it also means that you can only sell alcohol for takeaway. So that is the position. I think the challenge that the ministry and the experts have is we're opening up the space, you know, and we're struggling a little bit to control the conduct of people in those spaces.
Sorry for the interjection.
Yes.
Speaking of that, struggling to control the conduct of people, what will the repercussions be for non-compliance? How would one be able to practice social distancing, for example, in a nightclub where you can drink alcohol and you still have to comply?
I think it's a matter that people just have to unlearn their habits and
Dance far apart.
Dance far apart. Dance with a mask on, I suppose, because this is the space and it can be done. And also limit the number of people that are on the dance floor, for instance. There's a huge obligation on heads of institutions, on organizers and instigators to ensure that their space is managed in such a way, because my own thinking is that if you don't comply and you are found to be continuously in contravention of the regulations, your ability to continue that trading may be revoked. I think the government has a right to say we are closing Club X down because they have consistently not complied with the regulations. There is a challenge though, because this may require an increased presence of law enforcement at these premises. But the thinking really, and this maybe the business people will tell us, was to open up that space so that there's some kind of recovery of the economic space, over the next 10 weeks or so.
Thank you very much. Ms. Muya, having heard both Dr. Shamgula and Ms. Dosap, what are the key lessons from your perspective? You have touched on adjustments in the sector, but bearing all of this in mind, the progress, if any, from your perspective, what do you make of all of this?
Thank you. I think first, before I answer that question, I think obviously from the business sector, there are obviously some concerns that, as we transition to stage 4, particularly those sectors that were actually really hard hit, like the tourism sector, they have obviously put in place measures how they will be able to contain and control that. And the issue, for example, of the sale of alcohol, where they say in accommodation establishments or in the hotels, where you have guests that are actually staying there, are you also going to limit them to actually only buy alcohol until it's actually 6 o'clock, and they cannot even have alcohol within the hotel establishment where they are during that time. So that's just some of the concerns. Of course, lessons that have to be learned there is to ensure that obviously businesses have to adapt with the changes. There are serious concerns obviously in terms of probably people questioning that now, will they move especially to the digital revolution now, not really have impact also on the jobs? You've seen that quite a number of businesses are trying to adjust to say, okay, how do you make sure that obviously, particularly for the SMEs that have lost on income obviously, and but still trying to ensure that they still keep employees on the job, where they would want to negotiate to say, fine, is it possible that probably if there is an employee that is actually able to work from home on reduced hours, and that employee is also able to conduct an activity that can bring them extra income, so that obviously they meet each other halfway on whatever, on those regions. So those are some of the concerns. But also, I think it's very important at this stage to also make sure that also our colleagues in the labor sector also, come to the table and really be a little bit realistic in terms of really also understanding. I don't think there's any business that wants to put people on the street. Everybody wants to make sure that everybody actually has, bread on their table. But in these very trying and challenging times, how do you meet each other halfway? I would give an example, for example, in the tourism sector. So far, even the stimulus package that was actually put there, none from the tourism sector has actually received anything so far. So you can imagine how that sector definitely will have to actually start all over when they actually, have to open up.
What do you make of the stage 4 requirement that tourists would need to first present COVID-19 negative results that are not older than 72 hours and need to be subjected to quarantine at their own cost?
Well, that's a challenge, of course, but I think the concern here for government and everybody else, first of all, is really the health of not every citizen in the country, obviously. And I think we need to listen to the sector, particularly exactly in how they have actually prepared to be able to actually contain that. And I think obviously, if there's really good coordination between the countries of origin where these tourists are coming from in terms of really providing accurate information, so that we don't have cases whereby people come in the country and they're quarantined within a few hours, and then you understand that they also have cases. So that person will not even be coming to the country to enjoy their holiday, but actually to be patients.
Thank you. Thank you very much. Doctor, I would like you to very briefly touch on quarantine in stage 4 and also the trial period for tourists between the 15th of July and the 15th of August, I understand. And what are we seeking to establish with that trial period?
Well, the The trial period, this was the initiative from the sector, and as government, we are trying to make a fine balance between reviving the economy, and on one hand, and on the other hand, not to expose the citizen to COVID-19 transmission. I must say that when you look at countries who have been hard hit, when you look at the TV, you look at the United States of America, a country with a lot of resources, but they're unable to contain. Now, if you think of our small economy, our limited resource in terms of human resource, where you have not a big pool of healthcare workers who also themselves may become, infected and be out of circulation. So it becomes dreadful to imagine that you can just say, while we have closed the border for anybody else to come in, some specific people must come and simply move around freely. So what is your moral argument to say these ones can be contained for 14 days and the other ones not?
Thank you, Doctor. Just briefly on the quarantine at own cost.
Oh, the quarantine at own cost. Yeah. Number one, this will also apply to Namibians. To say, if you move now out, you know that we have a pandemic in Namibia. You move out. When you go out, you know that when you come back, you'll be quarantined at your own cost. There are certain objectives to limit the movement and also to limit the exposure of individuals.
Thank you, Doctor.
Yeah.
Thank you very much, Doctor. We've run out of time, unfortunately, Ms. Muya. Your concluding remarks, please.
As we actually transition to stage 4, I think we understand that many businesses obviously had lost a lot of income, and I think it's a big lesson for Namibians that the patriotism is such very critical. Let us support local businesses, and as they actually open up, many of the businesses obviously have to do a lot of adjustments. So let's be patient with them and support them as they do all these adjustments and make sure that we really support local, and let's all as Namibians really adhere to the regulations that are in place so that we can be able to contain this virus, because this is our battle and our fight all together and not something that is left to one sector of the economy. And please, as we actually now transition to this stage, please, let us make sure that we support local businesses, because that's the only way we can create jobs.
Thank you very much, ma'am. Your brief concluding remarks, Mr.
I think we must, travel locally and visit the beautiful places in Namibia so that we can also inject some capital in our local tourism industry. I just want to say to Namibians, this is just the beginning of our conversations. I think government is making every effort to communicate with the public. Any concerns that we have, this is not cast in stone. I think those must be brought to the attention of the relevant ministries, and we'll continue to review the documents and the regulations and guidelines that we have in place, and try and be responsive to the needs of our people. Thank you very much.
Thank you.
Wear your mask correctly, please.
Thank you very much. Dr. Shangula, you have the honor this evening to have the final word.
Thank
Briefly,
you very
please.
much. I must say that COVID-19 has exposed our vulnerability in many aspects. We have been relying on external sources, but now we found ourselves that some of the elementary things we cannot access because COVID-19 has disrupted all the commercial flight, all the logistic chain. It has created an opportunity for Namibians to do something locally. And I can give an example, like the masks, for example. People start now doing locally. So it can revive the economy by concentrating on that. We have also we are also sourcing things like, for example, gowns. They are being made now locally, and we are supporting that industry.
Thank you, Doctor.
So it's important to be self-reliant.
Thank you very
We have
much.
learned a lesson.
Thank you very much. Gentlemen and ladies, let's continue the good fight against this pandemic. Fellow Namibians, remember, together we are better. From all of us here at the COVID-19 Update Desk at NBC, it's good night and goodbye.